Hello, my name is Celine Ribnikar Acosta, and I'm going to be presenting on female orgasmic disorder. So, without further ado, let's go ahead and get started. A female orgasmic disorder diagnosis and symptoms. This disorder is the absence or marked delay or diminished intensity of orgasm. Abrams 2016. It has persisted for at least 6 months. For DSM diagnosis, it is not better explained by a non sexual mental disorder. It's not a consequence of relationship distress and not due to other significant stressors, including substance and medication effects or another medical condition. And this can be found also written out in the DSM, according to American Psychiatric Association 2022, the most updated version. So the prevalence is unknown but known. According to the DSM, there's a prevalence of orgasm problems in pre-menopausal women from 8% to 72%. And now that's a large difference considering that the percentage is dependent on multiple factors: age, cultural background, context, duration, severity of symptoms. All of that comes into play about the true percentage of those suffering with this disorder. However, these estimates do not take into the account of the presence of distress. So each case and each person living with this disorder will have a unique experience with this disorder, and the distress is really where essentially the disorder affects the most. Only a portion of women experiencing orgasm difficulties also report associated distress. So, again, distress is given to the overall quality of life, which as therapists, we're always focusing on how we're going to help treat and essentially increase the overall quality. Variation of how symptoms are assessed. So this will go into duration of symptoms, the recall period, which also influences the rates. Some of those who suffer with this disorder have had this disorder forever. Some of them have it short term, different variations, which we'll go over. And internationally, approximately 10% of women do not experience orgasm throughout their lifetime. And in the Grunwald 2019 study, it was notable that men and female focus groups had a difference in the negative impact of how their sexual encounter was primarily focusing on the male's ego instead of the experience itself of being intimate. So, female orgasmic disorder, the ideology is very unique. There's actually no true indication of where it stems from, how it occurs, essentially difficulties that have either always been present, like I had mentioned before, or if it's an acquired subtype, which these difficulties developed after a period of normal orgasmic functioning. And so this is very important to note, as a woman's first experience of an orgasm can occur anytime before their adulthood. Essentially, there's a whole period from pre-puberty all the way into adulthood that this can occur. So there's no true single cause, while there's a multitude of factors that can contribute to this disorder. These factors include medication intake, fatigue, stress, age, menopause, their relationships and the quality of those, how long they've been with a partner, environmental factors, and there's also some medical and psychiatric considerations according to Crookes 2017. And it is important to note that in relation to psychiatric disorders or different conditions, there is evidence that shows that depression and ADHD can affect the sexual lives of women who experience these disorders and can also hinder the onset of orgasm, according to Alacron Rodriguez 2024. And so it is important to note that women are essentially provided with a framework of how to stimulate their bodies and how they need to acquire more knowledge about their bodies. And so the orgasm sense of when being sexually intimate is always essentially that's the norm. You should always have an orgasm. And so it puts a different stressor on the woman, but also on the male. But for this, the purpose of this, for female orgasmic disorder, we're going to focus on the woman. And so sometimes there's just a limited knowledge of the sexual anatomy of a woman and what it takes to be truly aroused. Therefore, there's no true communication between partners about preferences, expectations, and stimulation. So all of these parts play into an orgasm and what makes that up. So considering a true assessment when working with a client who has a female orgasmic disorder, a comprehensive assessment is crucial and needs to be conducted prior to treatment. So we want to clarify the presenting problem. We want to determine if diagnostic criteria is met. We want to obtain a full, thorough sexual history and assess relationship functioning. So we want to focus on that, of course, at the forefront, but we also want to screen for other medical and other mental disorders. We want to go over any history of trauma, medication, substances, everything that we would for a different type of disorder, not just specifically sexual. We also want to ensure that there's safety instilled in our assessment. So we want to use the right language. We want to come from a place of understanding and true curiosity. And we want to essentially get a better picture of our client. So their personal identity, cultural influences, their religion, their sexual identity, different experiences that have led them to this point. We want to get all the background when we're considering full treatment. Cultural factors related to this disorder, there is always a stigma because who wants to talk about sex, especially in therapy? This is supposed to be a free place for you to explore any difficulties or hindrances in regards to your disorder. And so, given the sensitivity of the topic, an orgasm, we want clinicians to be able to meet their clients with cultural humility. And that's always at the forefront. Restrictive cultural and religious attitudes towards sexuality, especially for women. We want to understand that there may be a moral or spiritual concern that they may not realize supersedes in their eyes their medical or psychological disorder. And so we want to understand that. We want to provide them with adequate education. So some of our clients might not have the sexual education to understand their female anatomy, to understand that there's different parts that make up what an orgasm is and what it makes this disorder essentially so misunderstood is sometimes they don't have the basic idea of what it entails. So being able to come from a space where we're able to provide this information and the psychoeducation in a sensitive, non-judgmental manner is crucial. There's internalized stigmas and myths about sexual pleasure, especially for females. And so given this disorder's focus on the female orgasm, we want to make sure that we're understanding that gender roles are not the focus, but instead we want to acknowledge that women sometimes admit to feeling different and how these symptoms affect their actions can lead to casual sex, problems in maintaining romantic relationships, and difficulties concentrating during sexual intercourse. They can also describe the need to feel sexually confident in order to enjoy the actions of being intimate. They have reported that they have a negative view of their body image, according to Alacron Rodriguez. And so all of these different factors come into play on how we experience sexual intercourse, therefore, how we have orgasms as females. And so we want to definitely come from a space of understanding and humility when working with clients. The unique thing in being able to adequately assess and provide a therapeutic approach when working with females with this disorder is CBT. CBT was founded by Aaron Beck. He was a psychiatrist with psychoanalytic training. He was a faculty member of the Department of Psychiatry at the University of Pennsylvania, and he was the president of the Beck Institute of Cognitive Therapy. And a CBT therapist is one who will diagnose, educate, and consult with a client where the emphasis is on distorted, irrational thinking, which leads to emotional problems. So we want to work with a client to change these faulty emotions and behaviors through this three linked pathway. So those automatic thoughts is the self-talk. It can be situationally specific, like my partner doesn't accept me. It could be the underlying assumptions, attitudes, or rules. So again, gender roles, cultural background, all these come into play. I'm only acceptable if my partner feels superior, if my partner feels pleasure, if my partner is happy. These are then cut into core beliefs or schemas, where the underlying global assumption is I serve no purpose than to please my partner. And so, if that is the case for a female, they're more focused on their partner than themselves, therefore, could not be experiencing the sexual act with pleasure or happiness or engagement, therefore, not having an orgasm. So, these automatic thoughts commonly lead to thinking errors where there's problems. And so CBT, understanding the sexual health, behavior, and distorted functioning, CBT intervention will focus on educating the patient about psychological anxiety and biological sexual functioning. It will help identify and challenge negative thoughts that may influence social and romantic relationships. There can be a gradual exposure to anxiety provoking sexual situations that may contradict their cultural norms. And we want to make sure that we're doing this with consent from our clients. And then, of course, working with them in the collaborative way to let them know that that exposure is going to be done. There's also teaching relaxation techniques as seen in breathing exercises, progressive muscle relaxation, guided imagery, according to Wenchkin 2024. And this author also notes that previous studies have independently supported CBT, mindfulness, aromatherapy, and yoga for aspects of female sexual dysfunction. But few have combined these approaches into one treatment protocol. And so we're going to go through that next. Treatment goals should address the client's needs, but it can also extend beyond their current disorder of just focusing on an orgasm. CBT can improve not only an orgasm frequency, but overall sexual satisfaction, the relationship satisfaction, and again, the quality of life. Pharmacological interventions or treatments, there's no FDA approved specific medication that has been used to treat female orgasmic disorder, but there's definitely some